As we get closer to the start of the school year, there are still so many questions and concerns from parents as they decide whether or not to send their children back to the classroom. So joining us live to talk about this really critical issue right now is Dr. Chris Colbert from the Emergency Medicine Residency Program at UIC. So doctor, welcome.
Good morning.
What are you telling parents right now? Because every parent has a different decision to make. Every school district right now is different as well. So what are you saying to parents?
And that's an excellent point, because everyone has a different scenario, and their school are doing something different. My suggestion is always that as long as the school is abiding by guidelines and suggestions from the CDC, as well as the American College of Pediatrics, you can mitigate the transmission of the virus. Everything is a reference to exposure and contact. So for those schools that are specifically ensuring that the distance of the desks are different, they're limiting the amount of school for students. My children, for example, are going to school Monday, Wednesday, and Friday for half days. That will significantly mitigate the transmission of the virus.
What are you specifically saying to families too? What can individual families, parents do as well? We know schools have a plan, but it seems like families need to kind of have their plan when they wake up in the morning, what everyone's thinking, how everyone's feeling too.
True, very true indeed. In fact, things that can help is when you wake up in the morning, checking the temperature of your child attending school. In fact, some schools are even requesting that, ensuring that your child, when attending school, has hand sanitizer as well. Anything to supplement any process that will decrease transmission of the virus.
And how about parents who have kids with special needs, whether that is physical ailments like maybe diabetes, or even health issues, mental health issues that kids may be going through too? What do you have to say about those children who may need a little bit more help?
So that's a tough goal, and I acknowledge that. For those diverse learners that really require that one-on-one interaction with the patient, or must have more of a direct contact, I always suggest those parents have a really good conversation with the school, ensuring that they can meet the needs of education that you want for your child, as well as provide that safety options as well. For those diverse learners, there may be different options available, and it just may be an option of just possibly having a conversation with the parents and the teachers to find what are the best options to keep those children safe and ensuring they get the quality education that they are looking for.
Yeah, parents just need to be so involved, so active right now in asking all those questions. I also want to ask you about extracurricular activities. We heard a lot about sports this past week, of course, but it also makes me curious about band or other events that students might want to participate in. What do you think about all of that?
Well, again, it's about contact and exposure. As long as those extracurricular activities, whether it's band or it's tennis, in any capacity, as long as those entities are working to decrease any contact or decrease exposure, maintaining space, providing insight with specific or designated areas to ensure that space and masks are worn and there is hand washing available and or hand sanitizer. I think that's the best we can do with these specific situations.
All right, Dr. Colbert, thank you. Nice seeing you once again. Appreciate your time this morning.